Welcome to this guided body scan meditation for the stress reduction program at the University of Massachusetts Medical School. The body scan is intended to help you to learn to be more fully present and awake to physical sensations, whatever they may be. Some sensations you experience may be pleasant, and some may be unpleasant or even painful. You may notice that in some areas of the body there is no sensation at all. The practice is staying open to whatever is here from moment to moment, doing your best to notice the actual sensations themselves, perhaps aware of preferences for some sensations and the normal tendency to want other sensations, especially painful or uncomfortable ones, to be different from the way they are right now. And remembering there is no right way to feel as you are doing this. The way you are feeling is simply the way you are feeling. This practice is a way of investigating the body with awareness and compassion and without judgment. It is an opportunity for cultivating flexibility of attention. At times the focus will be specific or narrow. At other times it'll be broad or wide. Bringing awareness to any tendency to try to be in a relaxed state. Remembering we can create more tension if we try to strive for a particular outcome. The body speaks to us in the language of sensations, and this is an opportunity to listen with kindness. Be gentle with yourself, allowing yourself to be open and curious, and staying present and awake in each passing moment. It is helpful to treat this time as a time that is for you, a little time away from the world. An opportunity to be by yourself and with yourself more fully. You are offering yourself the gift of your attention and connecting to the sources of strength and wisdom and healing already within you. It is important to take care of yourself during this practice. The body scan should be practiced in a warm place where you feel comfortable and at a time when you won't be interrupted. Wear clothing that allows easy, natural breathing. Watching the body and the activity of the mind as we go along. Letting go of any critical or judgmental thoughts. Keeping an open curiosity and interest in what your experience is in each moment. During this meditation, thoughts may come and go, emotions may come and go, and acknowledging this as it arises. Gently coming back to paying attention to the body, to sensations, as we travel through the body. You can do the body scan lying on your back or in any posture or position that feels right for you just now. If lying on your back is not comfortable, find a position that is. It is more about the level of attention and awareness you bring to this practice rather than the posture you adopt. And now lying on your back with your arms by your sides and your palms facing towards the ceiling and with your feet falling away to the sides. Gently closing the eyes if this is comfortable, or finding a position that works best for you. As we explore the body, we are paying attention to the body just as it is right now. Not how it was in the past, or maybe in the future, but as it is now. There may be areas of the body that are different to an earlier time in your life. Or you may find that certain parts of the body are challenging to focus on. Maybe areas where you experience pain or discomfort. If this is your experience, you can choose to stay with the area and investigate the discomfort with awareness, with curiosity, and without judgment. Or if the discomfort feels too much or overwhelming, you can bring awareness back to the breath as a support. And when you feel ready, returning your attention once again to wherever we are in the body, knowing that you are following your own wisdom and taking care of yourself. Now slowly sensing the whole body as you lie here. The full length from head to foot. The full width of the body. Noticing where in the body you are experiencing sensations of contact, of pressure, and depending on the position you are now in, this may be felt at the back of the body, perhaps the backs of the heels, the calf muscles, the buttocks, the hips and lower back, the shoulders, the back of the head, the elbows and hands. Noticing the areas of the body where there's no sensation of contact. You may be aware of contact of clothing on the skin, perhaps contact of air on areas of the body. And now bringing your attention to the very fact that you are breathing. Allowing the breath to flow easily and the abdomen to rise and fall naturally. There's no need to change the breath in any way. Breathing in whatever way is natural for you. The breath knows how to breathe. It may be helpful for you to place your hands on the abdomen and experience the movement of the breath in this area. Noticing the rising of the abdomen as you breathe in and the falling back as you breathe out. Feeling the breath in the body. And now on the next breath, directing the focus of your attention from the abdomen all the way down the left leg, the left thigh, the left knee, the lower left leg, and down to the left foot, and all the way to the big toe of the left foot. Bringing awareness now to the little toe and the toes in between. You may be able to get a sense of the spaces between the toes. What sensations are you aware of in this part of the left foot? Maybe dryness or warmth, the touch of a sock or a blanket or the air. If there are no sensations, being aware of this and not judging it as either good or bad. Moving now to the sole of the left foot, the ball and the arch, the heel, discovering sensations in this area of the foot, or no sensations. There may be a sensation of tingling, or warmth, or coolness. Simply being aware of whatever is here, being present and awake. Moving attention now to the top of the left foot. Feeling, if you can, the surface and deep within this area. Moving now to the back of the heel. Maybe noticing contact with the floor. Moving awareness now to the ankle, feeling into the bones and skin in this area. Investigating what is here in this part of the body. Widening the experience now and bringing awareness to the entire left foot, including the ankle. What is here? And taking a breath, simply breathing in and out with your attention on the left foot. And now moving awareness from the left foot to the left lower leg, the area between the ankle and the left knee. What's here? Perhaps sensing pressure at the back of the leg, at the calf muscle. Maybe noticing contact with the floor. Maybe being aware of the weight of this muscle. Noticing any sensations at the shin bone in front. Awareness of the skin covering this area. Being present to the variety of sensations or the lack of sensations. Now moving attention to the knee. The kneecap in front, the sides of the knee, the soft area at the back of the knee. Bringing awareness to the position of the left knee right now and how this relates to the lower leg. And moving awareness now to the left thigh, the area of the body from the knee all the way up to the left hip. Awareness of the muscle and bone in this area. Sensations in this part of the body. There may be awareness of circulation, perhaps weight, pulsation. and breathing with this awareness. Bringing attention now to the area where the thigh bone rests in the hip socket. Being present to whatever is here with a sense of curiosity. And now broadening attention to include the entire left leg, the thigh, the knee, the lower leg, the ankle, the foot, and out to the tips of the toes. The full length of the left leg, the skin covering this area, and breathing with awareness. And directing attention now from the left hip across the pelvis, and now moving awareness to the right hip and traveling down the right leg, the right thigh, the knee, the lower leg, the foot, and arriving at the big toe of the right foot. What is here to be known? Awareness of the big toe, the little toe, and the toes in between. What are you discovering? There may be awareness of tingling, maybe pulsation, temperature, touch. And moving now to the sole of the right foot, the ball and the arch, the top of the right foot, being present to sensations. Moving to the heel of the right foot. What's here? Broadening now and allowing yourself pay attention to the whole of the right foot, exploring deep within this area. And breathing with this awareness. Moving attention to the ankle of the right foot. What is here to be experienced? And now moving attention to the right lower leg, the calf muscle at the back, the shin bone in the front, the sides of the lower right leg. Paying attention to the area of the body between the ankle and the knee and noticing sensations present just now. Perhaps feeling contact. Maybe a sense of the skin covering this area. Being present and awake, open to the experience of now. Moving attention to the right knee, the kneecap in front, the outer side and inner side of the right knee, the soft area at the back, and bringing awareness to the hinge of this joint, the position of the right leg and how the knee is involved in this. What is here? And now moving to the right thigh, the area between the knee and the right hip. Discovering sensations here. Awareness of the surface of the skin and also deep within. Maybe being aware of temperature, pulsation. There may be a sense of heaviness or lightness. Or some other sensation that has not been named. Sensing into the thigh bone as it rests in the hip socket. Present to what is here right now and breathing with this. And now widening the lens of awareness and paying attention to the entire right leg. The toes, the foot, the ankle, the lower leg, the knee, the thigh, traveling up all the way to the right hip socket and breathing with this focus of attention. Awareness of how you are knowing sensations in this part of the body. If you notice discomfort or pain in any area of the body when you come to it, remembering you can either consciously decide to stay and investigate the sensations. If you find the sensations are too uncomfortable for you, you may like to choose to return to the breath as a support, as a way of steadying. And when you feel ready, coming back to paying attention to the area of the body that we are focusing on. Moving now to the tailbone, the base of the spine. Perhaps feeling the pressure of weight or contact. Aware of sensations at the buttocks, the anal region, the genital region, the whole of the pelvic basin. Perhaps being with the breath right here in the pelvic basin, present to sensations deep within this part of the body. Moving from this area of the pelvis to the lower abdomen. Perhaps noticing the muscles moving in this area. The rising and falling back, breath by breath. Staying with these sensations. This flow of in-breath and out-breath for a few cycles. Moving now to the back, the lower back. An area of the body that offers so much support. This can also be an area where we can hold tightness and tension. And sensing now how you are feeling in this area. What contact you may notice. Any sensations in the muscles in this region. Moving now from the lower back to the middle back, the area by the waist. From here, moving to the very bottom of the rib cage. And moving up the back. sensing the expansion and return of the rib cage as the lungs expand. And as the rib cage opens at the back of the body, allowing the breath be received as fully as possible. And then breathing out, letting go of the breath. Noticing how the rib cage comes back to center. How do you feel this at the back of the lungs? At the back of the heart? Full attention to what may be very gentle movements. The subtle shift of weight. Being present to what is here for you within your body. Aware of the shoulder blades. The backs of the shoulders. The back of the neck. And expanding the awareness now and holding the entire back with open attention. The full width. The full length. From the base of the spine right up to the back of the neck. And allowing the breath move up through the entire back with awareness. Investigating with curiosity. Moving attention now to the front of the body. To the area of the stomach. Possibly feeling deep within this area sensations of digestion. Perhaps sensing the movement of the breath in the region of the stomach. The movement of the diaphragm muscle. And how this plays with the movement of the stomach. Perhaps deep in the body at the chest, being aware of the beating of the heart. The flow and movement of the lungs. And exploring this region. The region of the heart, the region of the chest. With this awareness, breathing in and breathing out, noticing all the sensations of the flow of the breath. Being present and awake. Coming now to the shoulders. The fronts of the shoulders. The tops of both shoulders. The backs. Awareness of sensations here. Perhaps noticing how the shoulders move with each in-breath and each out-breath. And now moving awareness from the shoulders down both arms, traveling from the upper arms to the elbows, down the lower arms and wrists, and coming to the hands. Noticing now what position your hands are in. What are they making contact with? And what sensations are letting you know this? You may be aware of temperature, maybe warmth, maybe coolness. Maybe aware of pulsation or blood flow. Awareness of the backs of the hands, the fronts. The fingers and thumbs. The nails and tops of the fingers. The knuckles. The skin covering the hands. Breathing now with this awareness. Coming to the wrists, the backs of the wrists, the delicate skin on the inside of the wrists. Perhaps feeling pulsation and circulation here. And now moving attention to the lower arms, the bend of the elbows, the upper arms, any sensations in this part of the body. Sensing the experience of both arms resting in the shoulder sockets. And now widening the focus of attention to include the fullness of both arms. From the hands, the wrists, the lower arms, the elbows, all the way up to the upper arms. And breathing with this focus and awareness. Moving now to the area of the neck and throat. Sensing the muscles at the back of the neck. And the delicate vertebrae in this region. The front of the throat. The ability to swallow. To breathe. Possibly feeling this breath at the throat. And from the area of the throat moving now to the jaw. Sensing the hinge at either side of your face. Exploring the possibility of allowing the jaw to relax. Noticing the chin. Moving to the sides of the head. The area of the ears. Being aware of the ability to hear in this present moment. Sensations at the ears. At the outer ears. At the inner ears. Moving to the back of the head. Perhaps being aware of sensations of contact or pressure. Sensations at the scalp. Maybe feeling a sense of the weight of the brain and the skull responding to gravity. Becoming aware of the top of the head, moving to the forehead, spanning the forehead. What sensations are here? Now the region of the eyes, the eyeballs and eyelids. Possibly feeling the sensations of the eyelids covering the eyeballs. The bridge of the nose, down to the nostrils. Sensing a breath at the nostrils. Perhaps noticing the temperature of the in-breath and the out-breath right here at the nostrils. Moving to the cheeks, the area of the mouth, the lips, the interior of the mouth, the roof, the insides of the cheeks, the back of the mouth, the teeth and gums, the tongue resting on the floor of the mouth, sensing the entire face, noticing all sensations at the eyes and ears, the jaw, the cheeks, the forehead, maybe feeling the touch of air on the skin. The face is an area of the body that is very active during our waking hours. So now, for this short time, just allowing the face to be in neutral. Nothing to do right now. Holding awareness on the face and expanding the focus to include the entire head, the sides, the top, and the back of the head. And breathing with this awareness. Broadening now and expanding the focus of awareness to include the entire body. The back of the body, the front of the body. Awareness from the crown of the head to the soles of the feet. Feeling the skin, the envelope of the body. Sensations of movement on the outside of the body and also on the inside of the body. Sensations of pulsation, of digestion, of the breath. Sensations that may be strong and some that may be subtle. Being present and filling the entire body with awareness. And continuing now to rest in this awareness of this breathing body, in the knowing that you have given time to offering yourself something positive for your well-being. A time for being, for nourishing, for renewing, and a time for knowing. And now staying present to this breathing body until you hear the sound of the bells.